There's a trend going on. It's quite obvious for the last couple of years with the bad economy, more unemployment, fewer people insured, that elective procedures are not being performed as often, or at least that's what the earnings reports are telling us for various companies, and that's going on as we speak. The earnings are coming out this week. What are your thoughts on that from cardiology, orthopedics? Have you seen fewer hip implants, or do you have any?
Well, I think our tissue bank probably reflects changes in the economy. So one of the products that Tom's Tissue Bank makes is bone grafts that are used in spine reconstructive operations. And there certainly has, I think, been a downturn in the total volume numbers used, and that's not. And we supply them to various other companies. So there certainly is a downturn. And I know for surgery in general, from 2008 to 2009, there was a decrease in 10% roughly nationally for surgical procedures. And when you talk to
what type are you referring to? Knees, hips, or
just in general?
Mm-hmm.
Total surgery. So obviously, if someone is, everyone understands that the job market is fragile. If you're in a huge company, you can probably take time out to have your surgery. But I think if you're in a small company, mm-hmm. or a medium-sized company even, you're afraid that if you take time off to have your spine problem fixed, that when you come back, they may find that someone else did your job just as well. They're just going to save you some money, and you go back to find you don't have a job. So I think a lot of people are in that situation. So obviously for emergency type things or urgent type things, they'll still get done. But for elective things, and many orthopedic things really fall into that category. I think the plastic surgery people are the people that are feeling it the most,
right.
For very elective, with much of being cosmetic oriented.
Cardiology and diabetes would not be something you would think of as optional, but have you even seen decreases in compliance with expensive branded drugs or fewer stents?
Absolutely.
Even? Yeah.
I mean, there's the amount of people just going toward the generics as opposed to the drugs that they optimally ought to be on has been huge.
Well, if you take a look at our health system, actually there's been, since April, we really noticed this trend since April, there's been a 10% drop in new patient visits to our health system. And we really scoured to try to figure out what's going on. And we talked with all of our colleagues in South Florida, and everybody's seeing the same thing.